Jungle.
हेलो एवरीवन एंड वेलकम टू माय चैनल अल्ट्रा हील होम्योपैथी। मैं डॉक्टर आरती पाठक और आज मैं आपसे बात करूंगी पेनफुल मेंसेस, डिस्मेनोरिया एंड एंडोमेट्रियोसिस की और होम्योपैथिक ट्रीटमेंट कैसे करते हैं इसका। तो चलिए स्टार्ट करते हैं। सबसे पहले ये जान लीजिए कि डिस्मेनोरिया क्या है। डिस्मेनोरिया मीन्स पेनफुल मेंसेस and it is one of the most common gynecological problem among women. The pain that is felt at the time of menses is termed dysmenorrhea. It is associated with pain in back and extremities, and sometimes there is headache and vomiting also. Next, we come to the types of dysmenorrhea. There are two types of dysmenorrhea, namely primary and secondary dysmenorrhea. The primary dysmenorrhea is most common among young girls and adolescents. It is due to the release of prostaglandins in the circulation. The excess of prostaglandins in the circulation causes congestion of the uterus and uterine cramps. The pain starts at the beginning of menses and lasts for a short time. It is mild to moderate, not very severe. No pathology is involved in cases of primary dysmenorrhea. Next is secondary dysmenorrhea. It is associated with underlying pathology. The endometriosis and adenomyosis are the most common causes of secondary dysmenorrhea. The pain is very severe and it starts before the menses and lasts long. The cramps or menstrual cramps are associated with very large clots in the menstrual blood and accompanied with menstrual cramps, and it is one of the most common causes of infertility among women. Endometriosis is the one of the most common causes of infertility among women. So, in cases of secondary dysmenorrhea, pathology is involved in the underlying. So, pathology is involved in cases of secondary dysmenorrhea, which is usually endometriosis, and it is one of the most common causes of infertility among women. Next, we come to the causes of secondary dysmenorrhea, most common causes, that is endometriosis and adenomyosis. In endometriosis, there is the collection of abnormal uterine tissue within the uterine cavity and outside the uterus also. It grows to involve other pelvic organs. And next is adenomyosis. It is the collection of abnormal tissues within the uterine musculature. Then is uterine fibroids and pelvic inflammatory diseases. It is one of the most common causes of dysmenorrhea, secondary dysmenorrhea. Secondary dysmenorrhea is suspected if, when you can suspect secondary dysmenorrhea, when the symptoms begin after adolescence, usually 30 plus age is most commonly seen secondary dysmenorrhea. Patients are already known causes of secondary dysmenorrhea and endometriosis, and the pains are long lasting, and it is associated with offensive menstrual discharge sometimes, and large clots are there in the menstrual blood are also seen. Then the diagnosis of the symptoms, diagnosis of the then comes the diagnosis of dysmenorrhea and endometriosis. The diagnosis is based on the tracking of symptoms, when the pain happens and how severe it is. If it starts before the menses, or it starts at the time of the menses, and how long it lasts. When the symptoms are worse and the concomitant symptoms along with the menstrual cramps. And the diagnostic is confirmed using the pelvic USG. Next is why choose homeopathic treatment. Why you should choose homeopathic treatment for cases of secondary dysmenorrhea and endometriosis. You should choose homeopathy because it is one of the most popular mode of treatment among people because of its effectiveness, and it is safe to use. There are no side effects involved. Homeopathy treats the root cause of the disease. It prevents the patient from undergoing any complication, and unnecessary surgery is avoided if you choose homeopathy in time. The next very important step in homeopathic treatment is the history taking. in homeopathic treatment, usually the past history of the female is very important. Next, we come to the important steps of the homeopathic treatment. Number one is case history of the patient. The past history of the female, when does her menses started, and how is the progression of the disease, since when the dysmenorrhea is she is experiencing, and how the severity of the disease, how the severe menstrual cramps are there, any stress or anxiety issues with the patient, the history of other illnesses with the patient, and the constitutional symptoms such as her likes and dislike, or thermal reaction, and other symptoms of the physical or mental symptoms of the patient are noted. So history is one of the most important step for homeopathic case taking. Next is prescription of the patient. Prescription is based on the analysis of symptoms given in the case history. Then medicine is prescribed based on the symptom similarity. The most suitable medicine is given to the patient according to the similarity of symptoms, and the medicines are usually given in acute medicine and chronic medicines. Acute medicines are usually given to control the abdominal cramps and uterine hemorrhages, the acute symptoms of the patient presenting complaints, and then the chronic deep acting medicine is given to cure the complaint of the patient and the underlying cause of the disease. So the root cause of the patient is treated with homeopathy, and it prevents the patient from undergoing surgery and other complications. So homeopathy is considered very effective in cases of female diseases. So the most common acute medicines given are belladonna, aurum natro, arsenicum album, iodine, sabina, and veratrum viridae. Belladonna is given in cases of endometritis with head congestion and delirium symptoms. Aurum natro is given in cases of chronic endometritis with hemorrhages of the patient. There is severe hemorrhages involved, and the hemorrhages are the most common causes of infertility and abortion. Arsenic album is given in cases of weakness and excessive exhaustion, physical exhaustion, and mental restlessness. Iodine is given in cases of endometriosis with breast congestion, and sabina is given in cases of uterine hemorrhages, and veratrum viridae is given in cases of very high fever along with the endometritis symptoms. Then comes the constitutional medicines or the chronic deep acting medicines that are commonly given. Number one is calcarea carb. The indications of calcarea carb are excessively profuse and too long lasting menses which come on too frequently. The general symptoms of calcarea carb female are fair, fat, flabby female, and excessive menstruation, and too frequent menstruation is important indication of calcarea carb. Next is SEPIA officinalis. SEPIA officinalis is the head remedy in cases of female diseases. It is given in cases of chronic endometritis. The tenderness is felt over the uterus, and there is constant desire to urinate with the patient, and there is congestion and induration of the cervix with soreness and burning. So it is also given in cases of endocervicitis. So SEPIA is the head remedy given in female diseases. Next is PULSATILLA. PULSATILLA is a female medicine. It is most commonly given in cases of female diseases. It is given in cases of dysmenorrhea when the pains are very violent and causes her to toss in all directions. The dysmenorrhea is very severe and the patient is aggravated in a closed room. So worse in a closed room, and amelioration in open air. The characteristic of hemorrhages are important. The blood is thick and dark, and it flows by fits and cramps, and the dysmenorrhea is very severe in cases of PULSATILLA. And the mental symptoms of the patient, mild and weeping tendency, these are also important for indications of PULSATILLA. Next is HYDRASTIS canadensis. It is also known as golden seal, and it is again a plant remedy. It is given in cases of uterine hemorrhages and menorrhagia. The bleeding is excessive during each period with pain and anemia. So the weakness and anemia are marked in HYDRASTIS canadensis. The dysmenorrhea is of congestive type with the subinvolution of the uterus. The uterus is very large and bulky, and it is given in cases of chronic endometritis. Next is medorinum. It is a nosode and it is prepared from the gonorrheal poison. It is given in cases of ovarian tumors, ophiritis, salpingitis and endometritis with a psychotic history. The psychotic history is very important with the indication of medorinum. If there is no psychotic history present, then medorinum should not be given. Next is VISCUM album. It is given in cases of chronic endometritis with subinvolution of the uterus. The uterus is hypertrophied. The hemorrhages are with pain and partly blood clotted and partly bright red. The pain is from sacrum to pelvis, shooting downwards, and the left ovarian pains are common in cases of VISCUM album. Next is Xanthoxylum fraxinum. It is also an excellent remedy in cases of dysmenorrhea and endometritis. The pain is very agonizing and it is along the course of the genitocrural nerves. The pain shoots down the thighs up to the knees, and the no position really relieves the patient. So these are some of the indications of homeopathic medicines given commonly in cases of endometritis. Some other medicines are also given which are not mentioned here. So according to the case, the medicines are given, and based on the similarity of the symptoms, each medicine is prescribed to the patient depending on the indications of the disease and symptoms of the patient. So we come to the conclusion of this video. So we have discussed the medicines given in cases of dysmenorrhea and endometritis, and how homeopathy is effective in treating the cases of dysmenorrhea and endometritis. The early detection of the symptoms is the most important key for the treatment. The medicines effectively manage the patient and prevent her from complications and undergoing surgery. It prevents the disease progression and completely cures the patient. In advanced cases, homeopathy acts as a palliative, so it is the hope for the hopeless patients. So homeopathy should be the first choice in cases of treatment of female diseases. If you want any type of consultation with me, you can WhatsApp me, or you can visit my website, or you can message me in the inbox. So keep in touch and like and subscribe my channel for more updates. Thank you for watching my video.